My name is Catherine Rosero Mindiola. Therapeutic clearing of amyloid B antibiotic to serum amyloid B competence. Definition: amyloidosis is a disease in which misfolded proteins aggregate and create large deposits in the tissue, causing organ dysfunction. Spark is organelle is solved as withering protein fall in and amyloidosis deposits.
Amyloidosis is the term used to describe a group of diseases in which deposits of an abnormal protein, called amyloid, form in tissues and organs throughout the body. Proteins are important molecules involved in almost every structure and function within our cells. They are made up of chains of smaller units called amino acids, which fold themselves into three-dimensional structures. Folding allows the protein to work properly and interact with other molecules. In amyloidosis, proteins are made in the normal way, but when they are released from the cell, they open up again. These abnormally folded proteins collect together in long chains or fibrils. The deposits they form are called amyloid. Amyloid fibrils are difficult to break down, and as they accumulate, they start to cause damage. Eventually, the build-up of amyloid fibrils stops the affected tissue from working properly. AL amyloidosis is caused by a bone marrow disorder. The bone marrow produces blood cells, including plasma cells, a type of white blood cell that forms part of the immune system. Plasma cells make antibodies to help fight infection. Each antibody is made up of 4 protein chains, 2 heavy chains and 2 light chains, which attach to each other to form the complete antibody. In AL amyloidosis, the abnormal protein that builds up and causes problems is the antibody light chain, hence the name AL amyloidosis. Instead of attaching to heavy chains, the abnormal light chains open up and bind to other abnormal light chains to form amyloid fibrils. These gradually build up over time. Amyloid light chain fibrils can occur almost anywhere in the body, but the organs most commonly affected include the kidneys, the heart, liver, spleen, nerves, and the digestive system. Treatment for AL amyloidosis involves chemotherapy, steroids, high-dose therapy, and stem cell transplant.
Application in medicine. The medical application of this therapy consists of support or replace of the definite organs as measure to reduce the accumulation of the precursor proteins of amyloidosis fibrils. A sufficient reduction of the detection of the substance of precursor accumulates can reduce mortality.
In places it doesn't belong can actually make people feel unwell and, of course, threaten their quality of life and their lifespan. So what do we do about this? How does one treat AL amyloidosis? So the strategies are sort of really 2 major categories. One is kill those plasma cells. So I showed you those plasma cells that reside in the bone marrow. If we could wipe those out, then we can't make any more of those immunoglobulins, and hopefully life would be good. Another approach would be to pull amyloid from the tissues. I said to you that the amyloid is sort of mucking up the works. And so if we had an amyloid vacuum cleaner, some way of actually pulling it out of the tissues, that would be wonderful. In current day, there isn't any types of drugs that really work to do that we know of. But the good news is that there's several drugs, experimental drugs in clinical trials, whose goal is to actually, or mechanism of action, is to really draw that amyloid from the tissues. So more to follow on that. But again, our major path outside of clinical trials, experimental clinical trials, is to kill those plasma cells. So how do we do that? Well, we use a combination of drugs, chemotherapies actually, and one of the most common combinations is the combination of something called bortezomib, dexamethasone, and cyclophosphamide. Sometimes cyclophosphamide is replaced by a drug called melphalan. There are other medications like pomalidomide and lenalidomide that are used and often combined with dexamethasone. There are other drugs that are used for multiple myeloma. Now, amyloid is a cousin disease to multiple myeloma. Both are diseases where there's a overgrowth of these plasma cells in the bone marrow. So myeloma is about 5 times more common than AL amyloidosis, and so we can borrow from their armamentarium. And as drugs are developed for multiple myeloma, we can try to see if we can use them in patients with AL amyloid. We know that often these drugs have more side effects in patients with AL than they do with multiple myeloma, so we don't always just take a myeloma drug and just throw it in the direction of an AL patient. And we mix and match, and so there's a lot of different combinations, which I'm not listing right here, but we can swap drugs around to try to make that work for us. There are a number of really interesting drugs that are in clinical trials for myeloma that we're starting to try in patients with AL amyloid. One of them is called venetoclax, another is called daratumumab, etc. So that list will hopefully grow and grow so we can be very effective at treating patients with AL. Another therapy that we use is high-dose melphalan with stem cell transplant, or some call it bone marrow transplant or autologous stem cell transplant, which is another way of killing plasma cells. So each and every one of those dots that I have listed under killing plasma cells, they all have the exact same goal: get rid of those plasma cells so they can't make any more of those bad immunoglobulins, those bad light chains, and then allow the body to, number one, not get worse, and number two, to actually heal faster. So the body knows that amyloid doesn't belong in the tissues. It's just not very effective at drawing it out itself. It does it, but it does it very slowly. And the metaphor I like to use is that if you imagine that you have 1,000 guys laying bricks to build a wall, and there's one poor soul at the back trying to take that wall down, he's not going to do very well, right? The 1,000 guys are just going to keep laying brick after brick after brick, and that wall is going to get bigger and bigger. So that amyloid is going to get worse and worse. However, if you can kind of get rid of those 1,000 guys, make them go away, then that guy at the back of the line, which is actually your body or a patient's body trying to heal, then that sole individual, so to speak, can actually pick away and get rid of the amyloid, and then that will reduce the amyloid burden in the body and make a patient better.
Pros and cons. Pros: the efficacy of cytosis chain therapy in suppressing the fast-again clone is of limited. B. Dysfunction of the amyloidous infiltrating organs and 24 or more of patients with amyloidosis is within 6 months of diagnosis. Birth and deaths are made at home for the grand lands. Cons: amyloid regress is very short and often does not occur at all. In the contrast to the general rapid clearance of the after cellular debris and efficient tissue remodeling, there are no effective therapies of the hereditary force and the systemic amyloidosis. Is and the use of application in Ecuador. At last, 65% of causes of the systemic amyloidosis are the monoclonal immunoglobulin light chain typic that is causing the B cell dyseries, and total of 16 paintings 18 and 17 years of again and different twists and the biopsies proving systems amyloidosis were serum and killings.
APP processing and plaque formation. Excess amyloid beta peptide is believed to be a main contributor to the dysfunction and degeneration of neurons that occurs in Alzheimer's disease. A beta is a 38 to 43 amino acid peptide that is derived from the beta amyloid precursor protein, APP. APP to a larger evolutionarily conserved APP superfamily protein family that includes the APP itself and amyloid precursor like protein 1 and 2 in mammals. All of them are single-pass transmembrane proteins with large extracellular N-terminal and a shorter cytoplasmic C-terminal. The APP superfamily shares several conserved domains. However, only APP generates an amyloidogenic fragment owing to the unique A-beta domain in sequence divergence. Though expressed in many tissues, APP is concentrated in the synapses of neurons in the central nerve system. APP can be sequentially two different ways by different sets of enzymes. An amyloidogenic pathway leads to amyloid plaque formation, while a canonical pathway does not. In general, almost 90% of APP undergoes the non-amyloidogenic canonical pathway, and 10% the amyloidogenic pathway. However, the ratio can be altered by genetic mutations, environmental factors and the age of the individual. Cleavage products of APP from both pathways play diverse roles that are important in neural development and function. The non-amyloidogenic pathway involves cleavage of APP by alpha secretase to generate two fragments. An 83 amino acid C-terminal fragment that remains in the membrane, and an N-terminal ectodomain SAPP alpha that is released into the extracellular medium. 3 enzymes have been identified with alpha secretase activity, ADAM9, 10 and 171. Importantly, cleavage of APP by alpha secretase occurs within the A-beta domain and consequently prohibits A-beta peptide production. Of note, the C83 membrane fragment can be subsequently cleaved by gamma secretase to produce a short fragment called P3 peptide and a C-terminal fragment. To date, the P3 peptide is believed to be pathologically irrelevant. The amyloidogenic pathway leads to neurotoxic A-beta generation. BACE1, the major beta secretase in the brain, mediates the first proteolysis step, which releases a large N-terminal ectodomain, SAPP beta into the extracellular medium. A 99 amino acid C-terminal fragment remains in the membrane. The newly exposed C99 N-terminus corresponds to the first amino acid of A-beta. Successive cleavage of this fragment between residues 38 and 43 by gamma secretase releases the A-beta peptide. The genic pathway occurs in the endocytic pathway, as beta secretase mediates the first proteolysis step in mature endosomes. The successive cleavage of C99 leads to the generation of A-beta peptides, which are secreted outside the cell. Monomeric and oligomeric forms of A-beta overwhelm the brain's capacity for clearance and degradation and form extracellular plaques, causing neurotoxicity through several mechanisms including microglial infiltration, oxidative stress, and synaptic damage. Most of the peptides are 40 residues in length, A-beta 40, with a small percentage containing 42 residues, A-beta 42. A-beta 42 is considered the more neurotoxic form, because the extra 2 amino acids provide a greater tendency to misfold and subsequently aggregate. Elevated plasma levels of A-beta 42 have been correlated with Alzheimer's disease. For more information.
Conclusion. Findings with the diagnostic of cystic amyloidosis require swing-up sub-elimination of amyloidosis deposits to maintain or restore vital organ function, such that measures to reduce production amyloidosis fibrillar pressure point and thus arrest amyloidosis accumulation can be effective. Thank you.